lived here all my life. Several generations before me, long before there was a Bagnell Dam, I had family here. And I was more than slightly aware of the need for medical care.
This area had been declared by the Division of Health as being the most critical area of need in the entire state of Missouri.
The nearest hospital was more than an hour away, so there was a demonstrated need for a facility, and the primary care physicians, Doctors Mason, Haggerty, and Mosley, all delivered babies. They were general practitioners. They had to take patients in the car up to Jeff City or down to Springfield for treatment.
Well, the ambulances were station wagons that the local funeral homes provided. And Dr. Mosley, who was very instrumental in the start of the hospital and was involved in it throughout his whole career during the time he was here at the lake, he used to tell the story about riding in the back of ambulances with the funeral home director driving. Walter Hedges would be driving, and Dr. Mosley said if he needed to do something, he'd call out to Walter, says, "Walter, pull over, I need to stick him." So that was the extent of the ambulance.
We had to study the various ways and means of establishing the hospital, of financing it, of course. A firm out of St. Louis, a fellow by the name of Lee Marchant, and his company, American Medical Facilities, he gave us some very vital assistance and actually proceeded to really oversee the construction of the hospital. He brought in 2 or 3 individuals from St. Louis who were a part of our committee, wound up being on our board. Bob Schwendinger, who continues to serve, Bob Bain from St. Louis, and Joe Matthews.
I was actually the lawyer for the corporation that set up the hospital, so my initial involvement was providing legal services to the corporation that got the certificate of need, got the feasibility study, arranged the financing, supervised the construction, and were undeterred by the doubters who said maybe it shouldn't be here, maybe we don't need a hospital.
One point that I really want to stress, this was really very much a community project. The bonding company led us to believe that it would not require any local financing. And we went along on that, thinking that would just be the case until about the 11th hour. And all of a sudden, we were told we had to raise $250,000. I am particularly pleased and I was proud of the response of the community. They accepted it very, very graciously, and they were very responsive. And within a short period of time, via donations of $10,000 or more, or $10, or and that I was very pleased with that.
The biggest challenge initially was just convincing the world that this was going to be a successful operation. Namely, we had no physicians, or we had like 3 primary care physicians, and now we have over 100. So we had to recruit radiology, emergency care, surgery, pathology. You can't operate a hospital without specialists, and those had to be recruited during the 2-year construction period.
It was not a very simple process, and certainly at any point in time, we could have been in jeopardy of not proceeding, but we didn't really focus on that. We focused on the fact that, hey, we're going to get this done.
Having to design, build, and operate a brand new facility, it is not for the faint of heart. You don't really have any comprehension of the first time you turn a spigot or a gas line or anything in an operating room or any of the areas. It was a first. I can remember Vicki Franklin, the very first employee, and I was like, you know what you're getting into here? You had an empty building with 90 beds. We weren't quite sure.
At the time that we opened the doors, and that was January 13th of 1978, I believe, we established a committee to sort of manage the affairs, both clinically and business-wise, of the hospital. That serving on that committee was Vicki Franklin, who was a director of nursing at that time, Dr. Clem Haggerty, who was our chief of staff, and Dr. Mosley, and myself. Now, clinically, don't worry, I had nothing to do with anything clinically.
I don't think there was a time when I was concerned it wouldn't keep going, but of course it was a different facility than what we have now. Fortunately, we have grown. We've added lines of service. Goodness, the cardiac program is outstanding. Additionally, we have the cancer center. These are things that until you have experienced the need and find that it's 80 or 100 miles away, and you don't realize what an asset and what a service that the community, that the hospital provides for the community.
That so many achievements along the way. To be honest, they've kind of surpassed, I think, what we had originally thought possible.
The size of the hospital, of course, has increased an unimaginable size now from what it started. It's really interesting to go up on the roof of the tallest part of the hospital and just see the segments of building and realize how much we have grown since those early days.
So there's a Babe Ruth quote where he said, "If you're afraid to strike out, you'll never get anything done." We'll have to pursue service lines and technology and physician recruitment that are on maybe the cutting edge today, that'll be standard of care tomorrow. The future leaders of the hospital will be lucky and blessed if they have some people that stay committed and involved and will spend the time to sort through the choices. There are plenty of opportunities to take this to the next level. Like Babe Ruth, you got to swing in order to get a hit. Don't be afraid of striking out.
I can remember my father talking about the fact when he was hospitalized that he saw people he knew, number one, perhaps working here, and the concern that they showed over his needs. And this is something I see continuing. I think it's still here today, and I think there's no reason it won't continue in the future.
I would say that our greatest strengths are, first of all, in our people and our staff. But first and foremost, above all, our community support, and that's been tremendous over the years. We tried to cultivate that from the very beginning. I'd like to express the thanks and the appreciation to all of the people that have, for so many years, so diligently worked to not only to establish the hospital, but to help it to grow, to develop, to sustain the hospital. It's been absolutely amazing to me, and continue to be just overwhelmed with what they have accomplished for the community.